Welcome, everybody. My name is Wendy Finkelstein. I'm a physician assistant here at Inner Glow Studio, and I am doing a presentation on long COVID. I promised all of my guests and those who could not attend our first Glow Circle that I would record this presentation so that I could share with you this really important information about long COVID. So let's dive in to long COVID. So to introduce long COVID, we need to understand that COVID persists in the form of a spike protein, whether you're vaccinated or had the infection, and the spike protein seems to linger even years beyond the infection. And the spike protein is starting to damage multiple systems and cause a lot of dysregulation, specifically the immune system, where it hijacks our immune capacity. And this reactivates latent infections, including Epstein-Barr and even Lyme in some individuals. We're seeing it disrupt our microbiomes, which links our gut to our brain, our gut to our immune system, and can be a driver of metabolic inflammation. We're seeing the spike protein induce so much autoimmunity and molecular mimicry because it changes morphologies of bacteria. We'll talk about that. I'm seeing so many more ANAs that are positive, increasing numbers of Hashimoto's, and even something called cardiolipin antibodies, which are antibodies that attack your mitochondrial membranes. So this is huge, as we're seeing a huge epidemic of so much autoimmunity like never before. And spike protein also is damaging and changing the lining of our blood vessels called the glycocalyx. This glycocalyx is super important because it helps regulate enzymes and proteins that have to do with our clotting system, our fibrinogen. That's why we saw so many microclots. And we're continuing to see changes in our blood vessels that impair our nitric oxide and our oxygen delivery. So this is another area where we're seeing a lot more cardiovascular disease and myocarditis and on heart and arrhythmias and things. So this is important to know. It really affects the nervous system. The immune system and the nervous system track together. And when the nervous system is responding to the immune system, it keeps the body in sympathetic overdrive. We're seeing so much more individuals who have lost the parasympathetic adaptation to stress, and we're seeing more insomnia, more anxiety, and metabolic disease associated with just being in sympathetic overdrive, meaning cortisol physiology is just running. We're in fight or flight and all of those things. So just to kind of give a little intro of the things we're going to be talking about, how it persists in the gut, and how this links to anxiety, because most of our serotonin is made in the gut, but there's another reason for anxiety we'll talk about later. It is turning on what we call cellular senescence, because these spike proteins are kind of changing the phenotypes of our healthy cells, turning them into zombie cells, meaning that they're no longer replicating properly. They're no longer sending signals of repair, and misery loves company. So when a cell is like a zombie cell, like zombies like to infect other cells, we're seeing a lot more turning on of senescence, which is basically aging of our cells. Again, the microbiome disruption is because the spike protein changes and is a bacteriophage, and these microbes change and which alter our immune response, which is leading to more inflammation and more metabolic dysregulation. We're seeing mitochondrial dysfunction at the heart of the spike protein, because when you have infections and you have spike protein, you have immune activation triggering inflammation, we are running out of energy, and our mitochondria are in and of themselves getting damaged by the spike protein. And so we're seeing reduced ATP production, as well as the precious molecule NAD. That is if there's anything I want you to take out of this, is that we're going to learn about how NAD becomes really depleted in long COVID. So again, we talked about this precious layer of our blood vessel called the glycocalyx, and how it's promoting more clotting and oxidation, and this is injuring any area of our cardiovascular system. So heart injuries, we're seeing cardiomyocytes. They have the most mitochondria. They have the most need for NAD. They're not getting it. Things are getting inflamed. If anything's inflaming this delicate layer of our blood vessel, remember the blood-brain barrier is made up of small capillaries, and these capillaries, just like our gut membranes, become leaky, and this leads to more autonomic nervous system and sympathetic overdrive and more mental health issues, because the blood-brain barrier made up of vessels is getting damaged by spike protein. So mitochondrial failure is at the root of all of this because the virus itself attacks the mitochondria, and the secondary immune response further exhausts the ability for mitochondrial function to keep up. So we're seeing long COVID as signs of weakness of oxygen delivery, right? We're getting shortness of breath. The brain is a huge, we need oxygen in our brain, and we're seeing more brain fog, more cognitive dysfunction, and we're seeing just fatigue overall. And again, I mentioned the cardiovascular abnormalities due to reduced oxygen delivery to tissues. So what are we doing about all this? How are we intervening? Well, we need to start with phase one, which I always say is bioenergetic support. We need to start ramping up the way that our bodies use and make NAD. So I do this a few different ways. I like to block, we'll talk about it later, but when we have more NAD requirements, so does the enzymes that break NAD. So we have to work with increasing NAD, but also trying to calm those enzymes that are breaking NAD down. I use EBO2, I use ketones, I use supplements that contain NAD precursors. And then phase two is we need to work on senescence. We need to work on rebalancing the gut microbiome. We'll talk about in a little bit, the different nutraceuticals and supplements that help the body come back into balance. So that is my phase one and phase two interventions. EBO2 is probably my go-to. I love EBO2 for detoxing the spike protein because it's basically filtering out the blood from spike protein. And also ozone by definition increases oxygen. So we're not only helping detox the spike protein, but we're increasing oxygen. And by increasing oxygen, we're increasing NAD production, because anytime oxygen gets used in the mitochondria to make energy, we're able to make some NAD. This is what it looks like, an IV in both arms. We pass the IV through ozone, and the ozone, and we also put it through a hemolumen where we use lights, red lights and blue lights and all kinds of lights to help with viruses and infections. And essentially it's just cleaning out your blood, and you can see the blood in the little container over there. And that's kind of a yucky one. So usually we want to see it nice, clean looking blood, like it looks like champagne. So these are some slides that are going to go over some of the interventions, why I like using some of these supplements. I like BPC 157 for COVID because it actually does all of these things. Blood vessel repair, it's anti-inflammatory, reduces cytokines, it helps recover from the tissue, helps brings oxygen to the tissues, and it also crosses the blood-brain barrier and helps with brain. So it's just like a whole body protection compound, lowering inflammation. I do love KPV with BPC. KPV lowers things like cytokines like NF-kappa beta and interleukins and TNF alpha and all of these cytokines that get upregulated. I like KPV because it directs the neuroimmune axis. So our brain is part of our immune system, and we have to signal these things properly. So it actually protects, it's a neuroprotective. So I really love KPV with BPC. Larazotide, I love this also with KPV BPC. You can combine it in one capsule. This blocks the protein that makes your gut leaky called zonulin. And when we block zonulin, we're improving immune surveillance at the gut. We're allowing the immune system at the gut to have more time to recognize and have the proper immune reaction to foods and that we're eating and digesting. So I love larazotide, KPV, and BPC as a trifecta. Now, butyrate is special for the gut. It's the energy of our colon, our microbiome feeds, our healthy microbiome feeds off of butyrate. And we know that when we have butyrate on board, we're making healthy short chain fatty acids, which help our microbiome make the beneficial bacteria that support not only metabolic inflammation, but they help the gut stay healthy. I wanted to just kind of review my the whole step-by-step cascade here that we're seeing. So obviously we have this initial viral assault, and then we have all of this damage and inflammation. And then because the infection drives up NAD, this NAD upregulates the enzymes that break down NAD, and now we have an energy tank, and this affects when our cells do not make enough energy. The mitochondria which is a huge regulatory organelle, loses its ability to calm inflammation, make antioxidants, and we just have this burnt out system. And then we feel it symptomatically with fatigue and all the things we talked about, brain fog. So that what happens, this is important to kind of remember with NAD, the requirement goes up, the enzymes that break down NAD go up as well. What is the body going to do? It tries to make energy to keep up. And what does it do? It tries to make NAD by using tryptophan. Now, tryptophan is a precursor to serotonin. So now we have another reason why our serotonin tanks and why we have mental health issues with COVID. And this further depletes the mitochondrial NAD production isn't proper. We're depleting something else called BH4, and this is just the precursor to nitric oxide. So if you think nitric oxide as the driver of oxygen delivery, now we have poor oxygen delivery. We have a decrease in those neurochemicals, specifically tryptophan. But when we don't have nitric oxide, it also leads to lower dopamine and lower all the neurochemicals, which is associated with poor mood. And then the mitochondria itself collapses because of the dysregulation and the antibodies that are also attacking the mitochondrial membranes. Because remember, cardiolipin is a fat that is necessary for the mitochondrial membranes to stay intact. So if we have a leaky mitochondria, we have leaky electrons. The electrons, these hydrogens and these carbons and everything that's supposed to be going through to make energy is leaking out of the mitochondria. So when we think of leaky gut, it's really leaky mitochondria first. So this leads to autonomic nervous system. We're in fight or flight. We start to have symptoms of arrhythmias and dizziness and dehydration, and this persistent spike protein is just further exhausting more of the NAD and the engine of our mitochondria. Again, we can't fight in other infections, so they persist like Epstein-Barr, and basically, methylation occurs within the mitochondrial membranes, and it leads to, again, it's just directing the cell through mitochondrial failure to become senescent, and this is not a healthy cell. So we talked about this, but just to reiterate how important it is, the cost of having low NAD equals low tryptophan. So that means low serotonin, low melatonin, and these are things that we're seeing with long COVID. We're seeing so much insomnia, so much circadian rhythm disruption. And again, we just went over this, but I'm just let you look at this slide and kind of take it in and just, really take in that it's a mitochondrial failure. And we need to work on improving, and how we do it is through redox. The difference, I always like to talk about redox as we have all this, you want to have NAD, right? But you have NADH, right? So NADH, that little hydrogen that sits on the NAD, that needs to be given off. When you give off the hydrogen to use as energy, because these hydrogens go in and make ATP synthase, which makes ATP, that's called a reduction. And redox is balancing the equation of oxidation and inflammation. Again, this is just a slide showing you the enzymes that are depleting NAD that we want to block. And these are some of the peptides below: SS31, MOTS-c, 1-MNA, MNN, and 5-amino-1. I use these very often as first steps to getting my patients having more NAD so that they can have the voltage and the hydrogens and the electrons necessarily to move through the electron transport chain to make ATP. I use the nicotine patch. It seems to help with the nervous system. It helps with acetylcholine, which is the neurochemical that's released by your vagus nerve. So I'm seeing a lot more people restore balance, especially those with those POTS-like symptoms, dizziness, tachycardia. I love using ketones with my NAT support because it bypasses the complex one in the mitochondria. This is where all the electrons get bottlenecked and there's a traffic jam. So you just skip over that. It helps the body make energy without having to do a lot of things. It lowers oxidative stress. It boosts NAD. It improves autonomic nervous system. It lowers and stabilizes blood sugar. This is just a fantastic initial treatment option that I use just to restore energy so people can have the voltage to start improving their immune system and start rebalancing the gut. These are all the things I use in my protocols for long COVID. I don't always use all of these for all my patients, but I usually start off with mitochondrial support using ketones. I use NAD precursors, the 1-MNA, the NAD, and all of these things. I like adding methylene blue when appropriate. I treat senescence with senolytics. I love the Healthgevity supplement down below with that copper label. I use thymosin alpha 1. And I just kind of think that we need a little bit of all of these categories, but it's very personalized because not everyone experiences long COVID the same. Some people just really have a lot of brain fog. They still seem to have energy, but they just can't think clearly. Other people have brain fog and fatigue. But what really matters most to me is what you don't necessarily feel or see, because cardiovascular disease and plaque and cholesterol, these things can be silent. And so it's important for you to, because no one's immune, right, to this long COVID problem. Like, you could think you're fine, but I think it's really aged us all significantly. I don't think anyone is immune to spike protein anymore. I think in some way, some shape, everyone has something in their body that's not the same since COVID. This is just reiterating the whole neurotransmitter cascade that happens with nitric oxide depletion. And in conclusion, I just want to really reiterate that it's not just a persistent infection, it's a multi-system energy crisis with mitochondria at the center. So I hope that helped you. I know I was kind of all over the place and I talked about some complex physiology, but I do think that we covered, and I hope you feel impacted by how this truly can be a silent and not silent problem for all of us in this new post-COVID era. So thank you so much for listening, and I hope that you comment any questions that you have below.